Right, the quadriceps. Now, we have the vastus lateralis, we have the vastus medialis coming on in the medial aspect of the thigh, then we have rectus femoris as well. So these are the three main ones that I tape. Obviously you have the intermedius underneath, but that's obviously going to be a little bit difficult to tape. So I'm just going to show you the demonstration for lateralis, primarily because it is just a minefield of trigger points. We have a cluster of trigger points down here around the knee, and we know how much that relates to patellofemoral joint syndrome, obviously dragging that kneecap a little bit to the lateral, and then we get some retropatellar pain, which is not ideal. So we'll concentrate on this vastus lateralis just because it's the larger one. However, rectus femoris, and you all know how important rectus femoris is, because once again, if this is tight, hypertonic, it'll put a lot of pressure back into the kneecap, but because it's also a hip flexor, it can reduce our hip extension ability as well. So the trigger point for that is way up high, so our decompression will be there. And obviously with the vastus medialis, the two trigger points are in the lower half of the muscle as well, but it does come all the way up here and attach, but our trigger points are here. But you'll understand the principle. Once again, knee is in flexion, about 90 degrees, because we want the muscle in stretch, okay? And then I have just anchored down a little bit just above the head of the fib, okay? I'm going to come up and along here, okay? Now, the great thing about vastus lateralis, obviously it's a huge muscle, as you're well aware, is that it has 3 trigger points here, has 4 here, has another one down here, and another one just under the greater trochanter. It's this one down here that I tend to see the most, so that's the one we're going to go with. You have a cluster of trigger points, 2 in the posterior, 2 in the anterior, so you can pretty well much pick them up with your decompression. Once again, 80 or 90, right over there, okay? Now, by all means, you can put another strip here or even another strip up here if you need to be. We are now just blended over just to the lower half of the TFL there as well. But that's the quadriceps. So vastus lateralis, rectus femoris, and our vastus medialis. It's just a matter of locating those trigger points, guiding the tape, the stabilisation, up along the length of that muscle.